pain costs the economy more than heart disease, cancer, and diabetes. So, generally speaking, to manage pain, we need to modulate the pain center in the brain or the nervous system. And in fact, that's what medications do. It's better life through chemistry. But what if we can modulate the pain center using external energy? So, all we really need is to modulate the pain centers or to activate them or inactivate them. So, we need to find a way to access the brain through an external source. And one of the possible routes is the visual system, because we needed an entry point that must have direct or indirect neuronal connection with the brain. So the question is, are there neuronal connections, whether they are direct or indirect, from the eye or the retina to the pain modulating centers in the brain? And the answer is yes, through some of our work, but mostly from independent laboratories around the world. Uh, they mapped neuronal connections that starts from the retina and travel all the way to the pain modulating centers. And I'm not gonna really spend a lot of time delineating these nuclei in the brain. So at least the theoretical ground is there. That is, there is connection between the retina and the pain modulating centers in the brain, which helped us formulate our first hypothesis, which is activating the visual system using different wavelengths of light will eventually modulate the pain centers. So we set to go with our first preclinical experiment with rats. And what we did was a very simple experiment. We got some plexiglass cages, we acclimated rats in them, and we started exposing them to different wavelengths of light, which corresponds to different colors. And we wanted to measure the amount of stimulus it take them to say, or not to say, but to infer that they are uncomfortable. And what we did was to place a source of heat under their paw, and a normal rat, after 20 seconds of that heat, will just move away. And once they move away, the heat immediately terminates. So the rats are free moving. If anything bothers them, they will just walk away. And we tested this with several types of colors, from white as the control to purple, blue, green, yellow, orange, red, and infrared. And what we noticed with blue and green lights, there was an increase in the threshold, which means it took more stimulus or more time for the rats to sense discomfort and move away. Interestingly, with red, we saw the opposite. It lowered their threshold. So rather than moving away at 20 seconds, now they're moved at maybe 15 or 12 seconds versus green light and blue, which increased from 20 seconds to actually almost the cutoff line, which is around 32 or 35 seconds, because we did not want to induce tissue damage. So we now know it, and we repeated this experiment several times. And the question was, now we know it works in rodents. Will that work in humans? So, because if it's a non invasive, low energy approach, it was not hard to get permission from the University of Arizona to conduct our first clinical trials on two cohorts. One was fibromyalgia, and the other was migraines. And I chose these two cohorts because these are some of the most challenging conditions that we face in the pain clinic, mainly because we don't really fully understand their pathophysiology. We don't know why some people develop fibromyalgia. We don't know why some people develop migraines. So, because we don't know the pathophysiology, all we can do is manage the symptoms, or at least try to. So, with these clinical trials for fibromyalgia, what we noticed is that white light, which we used as a control, really had no effect on their pain score, which we measured from 0 to 10. So the average group, their pain was around 8 to 9. When exposed to white light, there was no change. However, when they were exposed to green light, their pain dropped almost by 50%. The intensity of their pain dropped by 50%. And we saw something similar in the migraine group, which is the panel on the lower part of the slide. Again, white light had minimal effect. It was statistically significant but clinically irrelevant decrease in the pain intensity. However, with the green light, we saw a significant reduction in the intensity of the migraine. And I should mention that the patients we recruited were the patients that failed the conventional therapies that we have. And in addition to pain, we also wanted to measure the functional capacity, the quality of life, because I can tell anyone just sit on a couch in a dark room all day long and your pain will be better, but that's not a way to live life. So we wanted to also see their quality of sleep, which was improved with green light, and also their ability to exercise, their ability to work, all those improved. The frequency of the pain episodes and flare-ups, those decreased significantly with green light. One of the things which I never understood is the all admitted to having more desire to do house chores, which if personally if I was sick, I would really milk it and try to avoid house chores at all costs. But I think they were very excited to be able to perform the regular things that they missed doing. So we knew that at least for green light, we were able to control chronic pain. But can we also address other types of pain, specifically post-surgical pain, which is acute in nature? So we went back to the lab and we used a surgical pain model, which is making an incision in the hind paw of a rat. And that typically cause both mechanical and thermal sensitivity for about 48 hours or 48 hours to maybe 7 days. And what we noticed is that pre-exposing rats to green light decreased the mechanical sensitivity for acute pain in both males and females. However, for the thermal sensitivity, only males experienced better results. Female rats had no effect. So that was a little bit intriguing that there is a sex difference in the response. So we wanted to look a little bit into the mechanism. So we collected segments of the spinal cords and we started looking at the endogenous opioids, and there are three: the beta endorphins, the proenkephalins, and the dynorphins. And these are the natural peptides or molecules produced by mammals to control pain, and they have other functions. And what we noticed is in both males and female rats, there was an increase in the beta endorphin and the proenkephalin. However, the amount of increase was greater in males than that of females. We also wanted to look at the receptor because, after all, I am a pharmacologist. Because in order for a molecule to work, it typically needs to bind to a receptor to produce some kind of intracellular changes. So we looked at the opioid receptors in the body. There are three, possibly four, that still being characterized, but for sure we know there are the mu opioids, the delta, and the kappa. And we looked at the structure or the expression of all these receptors. And what we noticed in males is that there was an overexpression of the mu opioid receptors when they were exposed to green light. Females, female rats, they did not have as much increase in the expression. We did not see any difference in the delta or the kappa between males and females. There was no increase. So what that told us is, for some reason, male rats increased both the endogenous opioids molecules or peptides and also the receptors that are needed to manifest the activity of these peptides. And maybe that's an explanation. It's not the explanation, but it can be an explanation of why male rats responded better than female rats. Interestingly enough, both migraine and fibromyalgia, women are more predisposed to developing these conditions almost 9 to 1 compared to men. And in fact, the clinical trials we published, I think um, we had maybe a total of 3 or 4 men, and the rest of the cohort were women. So, but we also know we recently published that nociceptors, or the nerve fibers that mediate a painful or noxious stimulus, differs from male and females, and we're still looking into why that is. And this work was done actually by Dr. Frank Poreka. He pioneered this work, and he's looking more into it. So hopefully we'll have more on that part of the story. So we also wanted to see what happens to the cytokines when rats are exposed to green light. So we collected some of the cerebrospinal fluid, CSF, and we looked at two components, interleukins 10 and tumor necrosis factor alpha. IL 10 is anti inflammatory. So the more of IL 10 we have, the less inflammation we get. And what we saw with green light exposure in rats is that the more we expose them, the more IL 10 they produced in the cerebrospinal fluid, suggesting that green light act as an anti-inflammatory. On the other hand, tumor necrosis factor alpha is associated with inflammation. And what we saw with green light is that it decreased the levels of TNF alpha in the cerebrospinal fluid. So green light acted in almost in two ways, increasing the anti-inflammatory component and decreasing the inflammatory component. And that's why, or maybe an explanation to why it was so potent. And there is a slide I did not show you in post-surgical pain in rats. We wanted to compare green light, the efficacy of green light to NSAIDs like ibuprofen and opioids like morphine. And in fact, green light in the surgical model in rats was as potent as morphine. So we looked at the cerebrospinal fluid. Now we wanted to know, where is that change coming from? Is it the spinal cord? Is it the brainstem? So we collected segments of the spinal cord and the brainstem, and we wanted to see where we are seeing these changes. And for IL 10, actually for all of them, it was not in the spinal cord, it was in the brain, or specifically the brainstem. So with green light exposure, there was an increased expression of interleukin 10 or IL 10 in the medulla. There was decreased expression of tumor necrosis factor with green light exposure. And also, we decided to look at interleukin 6, which is also inflammatory cytokines. We also saw a reduction in the interleukin 6. So, again, green light relative to white light increased the anti inflammatory cytokines and decreased the inflammatory cytokines. But then the question is, where are these cytokines coming from, especially in the central nervous system? There are the two main sources are microglia and astrocytes. So we decided to look at both the microglia and the astrocytes. And what I'm showing here is the data for the microglia. Now, generally speaking, the microglia exist in two states. One is activated, the other is inactivated. So when the microglia is activated, it indicates that there is a pathogen, there's a condition that requires the microglia to respond by an inflammatory reaction. So when the microglia is activated, the cell body increases in size, and the processes, or the extension, the arms, if you will, becomes shortened. However, when there is no condition to necessitate an inflammatory response, the microglia is what we call a scanning phase. So scanning, the processes are long because they are looking to see if anything is going wrong, but the cell body is small because there is no need to synthesize any of the material. So we wanted to look at the microglia with white light exposure, which is on the left side of the screen. And this is a video, I'll run it in just a second. And when the microglia is exposed to green light. So what we noticed is that with white light, the microglia had large cell body and shortened processes versus green light that had small cell body and longer processes, indicating that green light hindered the activations of the microglia. And that might be the reason why we're seeing less of the inflammatory substances being released. So we quantified the video that I just showed you, and what we saw is that green light significantly decreased the size of the cell bodies and increased the volume of the processes, turning the microglia into a scanning phase, where the control condition, which is white light, really did not alter the activated state of the microglia. So, what that means is green light through visual exposure enabled us to modulate the neuroinflammation through modulating the microglia and the astrocytes. And we have similar data to astrocytes. We looked at it through immunohistochemistry, not 3D modulation, but the results were the same. So, what we can conclude from this is that green light exposure resulted in the deactivation of the microglia or hindering the activation of the microglia, thus decreasing the neuroinflammatory environment in the central nervous system, resulting in changing the milieu of inflammation that's typically seen with either acute or chronic pain, such that it alter the balance towards less inflammatory environment. This work and some of our work was replicated all over the world. So that's always a pleasure to see that people are able to replicate the work. And actually, I should have updated the slide. There were recently published articles as well looking into the effect of green light. And what I talked about is green light through the visual system. That also does not take away from other wavelengths through the skin. So there are two routes of entry. One is through the visual system, which what I talked about, but also through the skin. And that's a completely different topic, but in general, red and infrared has better penetration through the skin that can also alter the inflammatory components and can have similar responses in animals and humans. And one of the questions I was asked is why not continue with blue light? Why did you focus on green light? Well, one of the things that chronic pain patients or patients in pain generally complain of is disruption of their sleep because pain really can affect their sleep. And pain and sleep are intimately connected. One can exacerbate the other. And unfortunately, it becomes a vicious cycle where pain disrupts sleep and disrupted sleep aggravates pain further. Well, the problem with blue light is that it can affect the release of melatonin. It does something called phase shift. So melatonin start being released from the pineal gland later on. For example, if the natural circadian cycle for a person around 10 p.m., for example, that's when start to get sleepy because that's when melatonin their body was conditioned to start releasing. But if they are exposed to blue light, then rather than being released at 10 o'clock or 10 p.m., then it starts being released at 11 or at midnight. And that's why some of the phones or some of the computer screens, they have a sleep mode. What the sleep mode does is basically take the blue spectrum out of the equation. That's why I stuck with, or one of the reasons why we decided to pursue green light um, rather than blue. That being said, blue does have its other biological function. In fact, one of the researchers and a colleague of mine at the University of Arizona, Dr. Scott Kilgore, he is researching blue light and he found a lot of benefit. It's through visual exposure, a lot of benefit for PTSD. So, pain management started with really interesting approach, but is it really that interesting? Because all they were doing at the time was applying external energy, trying to activate or modulate the pain centers. Maybe they did not at the time understand what they were doing. But this is typically, when I looked a little bit deeper into it, this was an expensive therapy. And you probably can tell by looking at the outfit the gentleman receiving the therapy is wearing. He's actually well dressed. So, this is not a therapy that a lot of people can afford at the time. So, no one is going to go through this therapy unless they actually noticed some benefit. So, maybe we should go back or to the roots and really start looking and refining old methodologies that worked, but we did not know how it worked. So I with that I would like to acknowledge a lot of people that helped produce this wonderful work, and also the support from the University of Arizona, from the University of Arizona Comprehensive Pain and Addiction Center, from Oklahoma State University, the National Institute of Health, the Department of Defense, the Veteran Administration. All these entities actually supported and funded my research. And that's my wonderful lab. These are the people behind all this work. Some of them graduated. We got new members. So it's an ongoing project. We're very proud of it. And we are literally just scratching the surface.